Hey, it's Kate Bullock. This is another episode of Walk the Block. I'm down here in Brentwood and we're at the Northland Professional Building where we're going to talk to Reflections Dental Group. Come on, let's go see them. So I'm here at Reflections Dental talking to Dr. Ashish Mehta and Michelle Gagne, and we're talking about the trend in healthcare and dentistry specifically. Things are changing, and tell me about that.
Well, absolutely, and I'm sure you've noticed, and a lot of people who are viewing have noticed that healthcare is becoming more and more privatized, or in a sense, more and more corporations are coming in to the field, and that's the same with dentistry.
Yeah.
And so what I've found, having worked for some of these companies in the past, is that you sort of lose a bit of that autonomy.
Yep.
Even though they say they're going to let you do practice the way you want and that kind of thing. That may happen initially, but I feel that there's definitely a shift. And for me, it was important to just be a private owner, to stay as a small business that I'm running myself, because it just allowed me to have control over the things that were important to me, which was the patient experience, the quality that we're giving patients, and just sort of the overall dentistry that we're able to provide to people.
So what kind of things would a patient find different? Like if it's one of those, what did you call it, drill, fill, and bill, mass commercialized dentistry corporations, like what specific things are they going to have control over that you as somebody who's like, no, I want to keep it? Like, what is it? What's the difference?
Definitely the patient experience.
Yeah.
What the place kind of feels like, looks like. I think continuity of care. So a lot of these offices might have staff changes frequently.
Yep.
Right? So you're used to seeing a certain dentist or a certain person at the front, and all of a sudden that person's no longer there.
Yeah.
So for us, it's important to have consistency. For me, having the patient see one dentist, and not jump from dentist, because we all do things differently.
Yeah.
It's like someone who cuts your hair, you find someone else there and it's going to be different, even though the final product, you show them a picture and say, this is where I'm going, but it's going to be a different experience.
Yeah,
it's
totally.
The same as with dentistry.
And to the materials that you use, like you get to pick your products, right?
So in dentistry, we do. Yeah, in dentistry, like every other industry, there's different products out there.
Yeah.
And I always wanted to be true to what I would want in my mouth, which is what we consider gold standard products.
Yes.
Dentistry sort of as an industry is really about time is such a big factor. Not about spending time, but about cutting, shaving, exactly, how fast. So we get material on our desk weekly saying, hey, now this material will set in 30 seconds. Next week, hey, now it only sets in 25 seconds. So they're trying to shave seconds off dentistry.
Yeah.
And for us, I don't care if I'm shaving off 5 seconds, 5 minutes. That doesn't matter to me. What matters to me is that I'm getting a predictable product.
Yep.
That's going to improve the quality of life for this patient.
Right. Tried, tested, true.
Tried, tested, true. So for us, it's about, you're paying extra for that stuff a lot of the times because it's products that have proven itself. You're not going for the generic, the no name or the gray market brand. It's like, no, this is the product we're going for. This is the product we're going to use because we know it's proven itself.
Right. And I think one of the things you guys, are telling me about too, it's for those people who you pay by the service, right? In dentistry. So like if I have to come in and get a crown done, this is the cost of getting a crown done. And so profitability wise, shaving time is good for the corporation.
Yeah, for the bottom line, for sure. If you can do more procedures per hour, per minute, per whatever time frame, absolutely. And that's why I think the manufacturers, their big sell is, hey, we're going to save you time.
Yes.
You get to scan this tooth. You're not waiting 5 minutes for a mold, a traditional analog mold, which we like because we know it's just more accurate.
Right.
But we're spending more time there. So are we losing out and jumping to another chair? Absolutely. But where we're winning is that we can deliver something that we can stand behind.
But I mean, in your office, you have 2 chairs. And I think you did that intentionally because it's not about having as many chairs as you can fill,
absolutely,
right?
Yeah. Our motto is sort of one patient, one chair. So even in that other chair, that's usually where our hygiene happens. Michelle and I are working out of one chair.
Yeah.
And so we're not jumping around on roller skates, trying to get from office to office, popping in and out. It's about spending that quality time with that individual. That's what's most important for us.
I think that's so important, and really too, what you're doing is putting good quality material in there. And you talked to me a little bit about crowns and how, like, if it's not fit right, you're causing other problems.
Absolutely.
And then they're back again for another service and another service.
And I didn't know that. Coming out of school, you're not taught that, and then you stop and say, wait a minute. I'm trying to do what's best for the patient, and now they're coming in with a different problem. So what's causing this? And that sort of took me down this rabbit hole of studying about the jaw joint and what affects it. And exactly like you said, we're trying to provide a service. All of a sudden we realize, wait, that service has now triggered something else in that patient. And now their jaw doesn't feel right, or their bite doesn't feel right, or it's triggering pain. So we want to avoid that. Or at least we want to be able to see, hey, this is a potential before it even happens, or avoid it altogether.
So you talk about what a patient cares about, and if they're like, oh, convenience, time, how fast can I get in and out of there? I gotta get back to work. Well, yeah, you can get in and out, but you're coming back next week.
Well, yeah, and that's what we want to avoid.
Right?
Yeah, absolutely. Yeah, we want you to go home, be comfortable, and not have to come back to get something fixed.
Yeah, and I also like that about your experience, because my son had a procedure done here the other day, and that night you called me. How's he doing?
Right, yeah. And that's important. And I've always felt that follow-up has always been important for me. Yeah. And for me to do it, for me to check in on that patient, to see how they're doing, any questions. Because when they're here, there's a lot going on, there's a lot being said. Not everyone's processing all that. So to be able to give them a call, check in,
well, and you're still frozen sometimes when you're leaving here,
You're still frozen, you're just trying to manage everything that happened, that appointment, and to be able to connect with them at home,
right?
And just let them know, hey, we're here. What questions do you have for me now?
Right. By then they've had a meal or two. They've tested it out.
Yeah.
Right.
And stuff that they didn't think about, they can now ask. So that is so important for us. And for me, it's important for me to make that phone call, because I want to get that feedback right away.
That's huge. You don't see those in the big corporations.
I haven't experienced that, no.
I haven't, ever.
Well, and one of the key things, a mentor of mine, one of the key things he said, and that always I think about it and is always in the back of my mind, is, it's better to strive for perfection and fall short than to strive for mediocrity and attain it. And that's always something that we keep in mind. So yeah, we're not going to be perfect, but we're striving for that, and we rather get close to that than just to sort of pump things out.
So the trend of healthcare is this way. And so for people to really advocate for their own health and pick their healthcare provider, their dentist, their chiropractor, their whoever, they have to interview the dentist or the specialist to say, like, what are you about? I think that's a great point, and I don't think our system allows for that, whether it's healthcare or even some of the other industries you mentioned. But I think you bring up a great point, and that's what we like to do. For us, it's about having a session before we even have a patient sitting in the chair, before we're even talking teeth. Let's sit down and just talk about each other. Let's see, what are your values? What are you looking for? What's important to you? Let's get to know you as a person, and then we can also share what our values are. Absolutely.
What's important for us, and then in the end, we can say, hey, is this the right fit? Before you go and even put down a credit card or anything, let's make sure this is a right fit, and that we're gonna help you get to your goals. And that this is the right place to do it. Because the last thing we want is someone to come in, or anyone go into some place, get stuff done, and realize, well, that wasn't what I was expecting, or that's not what I wanted.
Right.
Whether it's buying an item, or doing a service, purchasing a service, you just want to make sure that, hey, I'm getting what I expect or what I want. Yeah. So I think that interview that's a great idea.
Yeah.
And we love patients to come and interview us, because we can tell them what our value system are, what our core values, and what we can hopefully help them with. Or not, if we're not the right people to do that.
Totally. And I think nowadays in the trending in healthcare, you need to be your own advocate.
You do, yeah, absolutely.
Right, and I think it's trending more and more that way. Like, you gotta be your own advocate for your own healthcare and your own full self-care, group that you bring on board.
Yeah,
make sure they have your back.
Google have allowed that to happen. I mean, we're coming in, patients now are so much more dentally aware. They have a high dental IQ, which we love, because then they're asking questions.
Right.
And then it allows us to sort of talk about procedures or products, or why we choose to do things a certain way, as opposed to why they saw something on Google, do it another way.
Yeah.
And that's great, because then we have this dialogue, and we get to have a conversation about we love what you brought in here. This is why we would do it this way, or this is why we wouldn't do it that way. And then they can choose what feels right.
That's amazing. That's amazing because so many people come in and they just don't know, right?
We don't know. Yeah, it's like me going, I go to, let's say, a chiropractor or physio. I don't know.
Right.
And so I have to do my own advocacy before I go in. And I'd love to have that opportunity to interview and say, hey, what can I expect here?
Yeah.
This is what time is of value to me. I want to be able to spend the right time. I want you to get to know me. I want to have trust. Is that place going to offer all that?
Yeah, absolutely. I love that. So if that resonates with anybody watching and they want to get a hold of you, what's the best way?
The best way to get hold of us is give us a call, 403-247-3733. Michelle Newcomb will be up front. She will answer your questions and connect you with us.
Awesome. Thank you so much. Be a good human.
Be a good human.
Cheers.
Cheers.